Thank you for viewing this RFID Community Connect video from AIM. AIM is an industry association for automatic identification technologies. It's not only RFID, but barcoding, IoT, or any other technologies that automatically identify and capture data. If you want to learn more about AIM, go to aimglobal.org or reach out to us to set up a one-on-one call where we can tell you a little bit more about how AIM can benefit your
Hey,
business.
our next presentation is about using RAIN RFID technology to achieve data-driven supply management and cost savings. This is with Alex Barinaga, from the Director of Implementation from VueMed.
Thanks, Michael. Yep, if you'll be kind enough to drive the slideshow for us. But yeah, we'll explain our RAIN RFID solution, particularly in the healthcare space. Like Michael said, my name is Alex Barinaga. I'm the Director of Implementation for VueMed. We're an inventory management solution in the healthcare space. So if you could move on to the next slide. So what was the problem, or what's the problem that we're facing, is the global medical device industry is worth approximately $500 billion, and there is an enormous inventory-related supply chain problem where the dollar share of products are not tracked or accounted for by hospitals, resulting in excesses of 20% of bloated inventory, excessive purchases, enormous amounts of waste, and charge capture errors, preventing revenue capture. So if we can move on to the next. Why is there such a gap? Because in healthcare, there is a large gap in the middle where there is no documentation or no speaking between the systems, particularly electronic record of purchase and the clinical documentation systems. So the ERPs that control the purchasing, the contracting, and distribution, value analysis are siloed from the clinical documentation, which is everything that's related to the patient care, ultimately for these devices. In many cases, in excess of $20,000, $30,000, particularly in the cath lab space, that are implanted into your body that are poorly tracked, not recorded properly, and obviously not generating revenue capture correctly. So if you can move on. What were the common pain points that our customers sought to seek out with our RFID solution? Is that we had a lot of stockouts and particularly hoarding, particularly in the healthcare space. Many of the clinicians and the staff would hoard supplies to avoid stockouts, or there's a lot of stockouts due to lack of visibility, and a lot of clinical staff running around on the floor looking for items. Expiration was an enormous pain point with these highly expensive supplies, in many cases dying or expiring on the shelves, or in many cases items that are recalled by the manufacturer, and there is total lack of knowledge as to whether these items exist on the shelf or whether they were implanted into a patient. Many of the processes were manual at the point of care as far as the entry of lot and expiration dates, therefore leading to many of the errors on recall and things of that nature. And then missing our item billing codes, which will result in insurance not paying or manufacturers not getting reimbursed. And then obviously errors in handling and missing orders. There is no, limited data available for the supply chain partners for reordering purposes, and especially across IDNs or large networks. There was an inconsistency across that information, and obviously with the lack of information, it's difficult to mine any of that information or get any particular analysis available for those information. So who are our partners? If you move on to the next one that decided to solve this solution, our first was the International Heart Institute at Loma Linda. They're an academic medical center encompassing 6 hospital systems with over 1.5 million annual outpatients, and they cover roughly 25% of the Southern California market. And they operate approximately in the cath lab space, which is the area that we manage the solution, at about 37,000 SKUs, valued at approximately $16.5 million. If we move on to the next, our second partner in this was Munson Healthcare, also an 8 hospital system with over 1 million annual outpatients, covering 29 counties in the northern Michigan Upper Peninsula area. Slightly smaller inventory footprint as they operate 7,000 SKUs, but still valued at roughly $3.8 million for these 7,000 SKUs they have on hand. So what was the solution that we put in place? If we move on to the next, it was the VueTrack RFID RAIN RFID solution. And why did they choose these? Because we use standard RFID readers zonal and steerable antennas, GS1 passive UHF RFID tags that are constantly automatically tracking the movement and location of tag supplies. It's hands-free with little or no human interaction required. It's no costly or specialized RFID cabinetry or anything like that. We use standard antennas in the ceilings and in the infrastructure of the hospital already to track the items throughout the procedural space, thus turning any space or room in the hospital, procedure room, supply room, dock, hallway into an RFID controlled area with full visibility of on-hand inventory items and their movement. And we're able to then report live and in real time our inventory transactions with approximately 99% accuracy. The most important part about this is it captures the UDI data and enables the facilities to identify and track these devices throughout their life cycle, from point of entry in the hospital to point of care in the procedure. Uh, the chain of custody for these items, particularly in the cath lab space, where we're talking specialized heart valves and things like that, that can be in excess of $35,000 for a small 2x2 box that many times go on shelves, and clinicians and or nurses have to run around between the different labs in their facilities to see whether they have them stocked, where they have them stored. And it prevents the clinicians and the nursing staff from providing patient care because they're running around looking for supplies. And like we said, we use the standards-based, easy to scale operation that enables transparency and full chain of custody for these items. So if we move on to the next. What does it encompass? So the first part of our solution is a hands-free automated RFID tagging station. So using our VueTrack software, when the manufacturer's product barcode is scanned for an item, we take the FDA-mandated UDI data, which is resident in that barcode scan, and encode it into the RFID label. It either can have print on it, as you see in the example on the left of the screen on the top, and then on the bottom it can also be blank if manufacturers do the encoding at their warehouses, because that is an FDA mandated requirement that if there's additional print on the label, it would then be an additional label on the package, which would require additional validation. But if the facility tags the items themselves, as you see the example of the tagging station on the right, they're able to use human readable print on it, which also allows for the lot expiration information to be encoded and printed directly on the tag. Most importantly, creating an individualized serial number for each individual item that they have. Many cases, manufacturers lot and expiration combinations, if items are produced in bulk or on a specific day or on a specific cycle, may share the same lot and expiration combination. So this allows for those high dollar items to have a unique serialized number or tag identity that allows each individual item to be tracked throughout the facility. And this tag actually, not to shamelessly plug it, but is produced by Tadvik, and it was the winner of the AIM case study this year for RFID innovation. It is a removable tag that uses a Frog 3D inlay, so allows for maximum readability throughout the facility. We move on to the next one. So how's the infrastructure set up? Using standardized antennas and impinge readers in the facility. They're mounted either ceiling level inside existing cabinets or inside existing areas. We're able to create RFID read zones to allow the items to be tracked throughout the facility. So in the example, as you see here, there's a series of antennas inside the procedure rooms, allowing for each of these to be a zone, as well as items in the hallway to be allowed to be tracked throughout the area. Location change is the premise for our solution and our software, as opposed to a constant, read and report situation. We report based on location change. So as the item enters the facility through the hallway, that would be one location reported. It would move into the supply room, presumably, which would be a second location change. The item would then change locations, then ultimately leave the supply room, possibly move back through the hallway, and ultimately into the procedure room where it's either utilized and or not utilized, and we go back to the supply room. All those location changes would then be reported to our cloud, and ultimately would allow for a chain of custody for the items throughout the facility. Move on to the next. Some examples of what the overhead infrastructure looks like. Standard, circular polarized antennas mounted in the ceiling, as you see there in the supply room. Throughout the hallways, some specialized flat panel antennas mounted inside the cabinets, as you see there in the bottom middle photo, that allow for all the items inside that cabinet to be read, and then specialized antennas, also circular polarized antennas in the procedure rooms, particularly near the documentation stations where the items ultimately are consumed and added to the patient's clinical record as the item is consumed. So we move on to the next. The most important part of this is that the UDI data is captured and disseminated amongst all the clinical systems throughout the facility. So we kind of act as the middleware through our cloud reporting and analytics service. We're able to feed the ERP system, so that allows for the item to be reordered, to be managed, for pricing updates to be changed, et cetera, and allow for automatic reordering based on consumption on an immediate basis, but at the same time allows for accurate documentation in the clinical reporting system, so that patients have accurate information as far as the items that are being implanted, put in their body, in many cases with highly specialized cardiac procedure items. So you have accurate records of lot and expiration combinations in the event that an item unfortunately is recalled or needs to be explanted. They're able to locate these items in seconds through our clinical reporting site, as opposed to searching through many old 3-ring binders that they used to have full of stickers from products, and ultimately allows, as you can see there, a chain of custody from the item from the point of receipt at the delivery and dock area, ultimately into the supply room and into the procedure room at the point of care, and back and forth throughout the facility. If we move on to the next. So what were the key achievements that we were able to obtain through this project? We click on that. Several we have some operational achievements. So we were able to fully automate key inventory management and item documentation functions, which allowed for the full visibility of items from requisition to patient charting. In many of our case studies, particularly in the case of Loma Linda, they were missing in many opportunities at a 90% rate charge capture. So they were leaving 90 to 95% of the dollars on the table and not getting reimbursed for these supplies that were extremely expensive to begin with. So this solution allows accurate patient charting to allow for accurate reimbursement, and allow that reimbursement to then turn into dollars for the facility. So that's the operational achievements that we had for this solution. We move on to the next. Patient safety. Obviously, we had increased patient safety, so we have expired items that are never placed in patients. Prior to that, clinicians and/or staff in the room had to look at an item and see if the item indeed was expired or not expired prior to utilizing it. With our solution, there are audible signals in place that if the item comes into the zone or into the read range and it is expired, it would perform an audible signal that it's about to be utilized, even though it's expired. Prevents the stockouts as the items are visible throughout the procedural area, and they know where the items are stocked. And recall items can be tracked back to individual patients, like we said, within seconds, as opposed to hours and/or days that it took previously to look up prior procedures. And lastly, there, I believe we have financial, which is allowed the facility to align their purchases with consumption. So the excess inventory was reduced significantly. Prior to that, like we said, there was lack of data mining available. So facilities were unable to accurately estimate or accurately forecast their needs, because they had no record of consumption other than what somebody told them was utilized in a particular day. With the RFID documentation in our reporting site, they were able to track this on a instant basis, and then the waste through expiration is nearly eliminated, as you're able to forecast 90 days in advance as far as you want what items are expiring within the next 30 days, within the next 60 days, within the next 90 days, where they're located in the facility, so very easy to go find them and or utilize them prior to them expiring, or proactively leverage their suppliers to get them exchanged. And like we said, the increase in accuracy of charge capture to greater than 90% in all their cases, thus leading to greater financial outcomes for both of these facilities. So the ROI in both of these facilities was greater than 200% the cost of the investment of the RFID infrastructure and the RFID procedure. So if we move on, I believe that kind of wraps it up. Went a little quick there to allow some time if anybody had any questions, but that is VueMed. That is our inventory solution through VueTrack RF. We're an inventory management solution, particularly focused on the hospital or healthcare space, and we would love to answer any questions if there are any. Michael, back to you.
Yeah, thank you again for your time today and for showing us that use cases. The first question we have is basically, what, in your opinion, are the biggest barriers for RFID adoption within healthcare?
Getting past the initial cost. I think it's assumed that it's going to be expensive. Just when you say the word RFID, everybody assumes it's going to be expensive. But when you show them that it's based on standard equipment, there's nothing special about what we utilize. That it is much more accessible than people believe it to be. Some of the other solutions in the past in the healthcare space were cabinet based and specified to specific areas and were quite costly. So once you get across the cost barrier, which I'm sure is the same in every industry, then the adoption barrier is probably the next largest challenge, is having the staff to believe that it's actually doing something. People are visually focused, and in the beginning, it's kind of difficult to get that level of trust that that it's not just walking around the room. People aren't blinking or glowing as they go into different areas. But once they get trust and that the items are accurately reported as to where they are, then the solution pays for itself.
And then if you could walk us through how RFID or RAIN RFID integrates with existing healthcare IT systems, such as the ERP platforms that you'd showed earlier in the presentation.
Yep. So the VueMed application kind of acts as the middleware. So all the data that gets reported to us from the RFID infrastructure is fed into our cloud reporting analytics database, and then we have integrations to all the ERP softwares, whether it's Oracle, Workday, all the electronic medical records, whether it's Epic, Cerner, et cetera, Meditech. We act as the middleware, providing those systems with consumption information and/or reorder information on a instantaneous basis, as opposed to many of the processes which were probably manually oriented in the past.
Great. Well, thank you again for your time today, and
Absolutely.
really appreciate that. And again, Alex's contact information is on the screen now, but we will send you any additional questions that we have as well.
Great. Appreciate it. Thank you.
Thank you.